great. My wife, right, who I knew for 50 years, when we were married for 42, died in February of this year. Her name was Barbara. At medical school, we get taught something which is called allopathic medicine, which I'm going to show you. Allopathic medicine is how to treat somebody who's walking along, slips and breaks an ankle, or gets pain in the chest and falls down, and they're obviously having a heart attack, or has a gallbladder, or gets flu, and you give them the pills, and you give them things, they've got high cholesterol, you give them a tablet. The anti-cholesterol market is $20 billion a year in America, right? So that's what allopathic medicine is about. It treats the acute problem, but it doesn't actually save anybody in the long term, okay? So allopathic medicine is a total waste of time. It really is not a total waste of time. It's good for the acute stuff, but it's not good for you if you want to survive. America has got the biggest monetary spend on medicine and healthcare in the entire world. On the league tables, they're 30th, right? And there's a reason for it. It's because allopathic medicine doesn't stop you getting sick, and doesn't stop or slow chronic diseases, and it doesn't prevent you having another heart attack. That you've got to do something else for. Obama is a very forward-looking guy. And at the beginning of this year, he got hold of a whole bunch of doctors, not only conventional allopathic doctors, but a whole lot of people who are, inverted commas, on the fringe. Because what I'm going to tell you is on the fringe, right? And all of them sat together and they said, this is how we've got to take medicine in America in this direction, or it's going to break everybody. Next slide, please. Okay, two basic kinds of medicine. Allopathic medicine treats the problems after they happen. Surgery, pharmaceuticals, chemotherapeutics, radiotherapy. Functional integrative medicine tries to prevent or reverse illness by dietary and behavioral modification. And difficult. I have an example in here of a difficult person. Next one, please. What is functional integrated medicine? It's about good nutrition and anti-aging strategies, because everybody wants to live a full and healthy and wonderful life and not be incapacitated and not have a poor quality of life or poorer than you need to have, because you correct the problems. So, you are what you eat. There's a study called epigenetics or nutrigenics. There's a chap in the States called Dean Ornish. Dean Ornish is a physician, registered, he's a real doctor. Dean Ornish was on the cover of Time magazine. He was recently on CNN with Bill Clinton. He was voted one of the top 10 doctors in America, right? And Dean Ornish's statement is this: you don't have to be the sum of your genetics, because your father died of a heart attack and your brother died of a heart attack and everybody has a stroke or type 2 diabetes in your family. It doesn't mean you have to have that as well, because you can prevent it. You can prevent it by the way you eat. You are what you drink. Never smoke. And then, contrary to what everybody says, get in the sun. You can see I get in the sun. Exercise. If you can't exercise, it's actually not the end of the world. It really isn't. You can walk. And if you can't walk, that's also not the end of the world, because I'll tell you about someone called Caldwell Esselstyn just now. Finally, really think about what you're doing. Not only to yourself, but for yourself. Because everybody has got, when they get to our age, has had quantity of life. But what we're looking for now is quality, right? So it's no good having everything if you don't have your health. Because without your health, you've got nothing. You may as well not have it. Next one, please. So, these are the people that I can quote easily, because these are the books that are published. Okay? So here's a book called The China Study. If you get one book and one thing from this talk, this is a book to buy. You can actually buy it in Cape Town now, because the chap was in my house the other day. I was speaking to him, he saw it on my desk, right? He went up and bought it. It is a brilliant, incredible book, written by a man called T. Colin Campbell, who has studied nutrition. He's a PhD. He's not a doctor in the conventional medicine way. He's a PhD in nutrition. And he is at Cornell University, and together with the Chinese government and Oxford University, did a 20-year study in China on illnesses and diseases and the cause of sickness and why people get ill, right? And this is a brilliant book. It's called The Grand Prix of Nutritional Studies. There are people that criticize it. The people that criticize it, there's a perfect example, is the thing called the Western Price Foundation. The Western Price Foundation is backed by agriculture. Like the American Agricultural Department, right, is not happy about this kind of stuff, because the Agricultural Department represents dairy, represents meat, right? And those are big things and big money. Very important, okay? This man here, Cordell Esselstyn, was the head of a department at the Cleveland Clinic. The Cleveland Clinic is famous for the treatment of heart disease. But he was a general surgeon, but he was very unhappy about the fact that whatever he did, he really didn't get very far with various things, problems. His father died when he was in his 50s, a brother had heart disease, and he started reading up about this, and he thought that he had discovered a way to reverse or prevent heart disease. At the same time that he was doing that, on the other side of America, Dean Ornish was doing the same thing. And they have both published multiple books and articles in what's called peer-reviewed journals. Peer-reviewed journals are medical journals where your peers look at it and say, that's good, the guy's actually talking sense. The thing he's done is right. This is not a whole lot of rubbish. And then they publish it in the journals for general consumption. But unfortunately what happens, doctors don't know about this because they don't get taught this in medical school, they don't study it, and they don't know, and so they don't tell. The cardiologist doesn't tell the patient who's had a heart attack, this is what you need to do. And the stuff that they use is completely wrong. Where's that book that I picked up, Angie? I was in a doctor's office today and I picked up a book, I asked her to take it, and I just want to show you this book. Okay, so these two guys now know how to reverse heart disease, and they teach it. And you can reverse heart disease, right? And here's Eat More, Weigh Less, and I'll go into that. This is Rip Esselstyn. This guy is a firefighter, right? He's not a doctor, but he happens to be this man's son. So he's been brought up, right, eating the right things. He's a triathlete, but he works in a fire station. But having been brought up with the correct nutrition, the correct diet, and believing it, he said to his buddies in the fire station, listen, you guys, you're overweight, your cholesterol's horrible, let's do something about it. And they all did something about it. Their blood pressures came down, their diabetes disappeared, their cholesterols became normal, and suddenly there were 20 people that were completely healed. So in the States, what do you do when you do a thing like that? You get hold of a publicist. So now suddenly it was in the New York Times, and then the next thing he did, he wrote a book. You can't buy the book in America. It's off the shelves. It's been off the shelves for a year because people are gobbling it up. Got television programs, not a firefighter anymore because he's a multi-millionaire, right? And he's doing nutrition. And nutrition is what everybody should be doing. You see, this is a very nice book. It's called Heart. It has been put out by the South African Heart Foundation. I'll talk to you about that book. This is a man called John McDougall. The scientific research shows that their program reduces the need for most medications, lowers blood pressures. It does all these things, and if this stuff was rubbish, it really wouldn't be in the mainstream. And then what happened, the most incredible thing happened about 6 weeks ago, or maybe 2 months ago, I can't remember exactly, but I saw it, and you can see it on YouTube. Bill Clinton was addressing a world meeting on environment. So he's talking about environmental impact of all the cows. For example, if you eat plant calories, 1 calorie to you has cost 2 calories to produce. But if you eat meat, 1 calorie of meat has cost 80 calories to produce. Because you have to grow corn, you have to feed the corn to the cattle, you have to slaughter the cattle, you have to do all the other things, and the fuel and the whole trip. So, not good. So, he's talking to this enormous audience about pollution and the environmental impact and carbon footprints, and then he says, well, incidentally, I've lost 24 pounds. Everybody's ears pick up. Suddenly he's on CNN being interviewed by Wolf Blitzer. And Wolf Blitzer says to him, how did you lose 24 pounds? Everybody wants to know about that. So he said, well, I have a daughter who just got married, and they're focusing on him. And his lips quivering. You can see the guy's crying. And I've had 2 heart attacks, and I want to see my grandchildren. So I become a vegan. Sorry, this is what it's about. I become a vegan. I now weigh what I weighed when I was at university. I'm reversing my heart disease. It's been demonstrated that 85% of people who do this will reverse their heart disease. When they reverse their heart disease, what else do they reverse? They reverse insufficiency to the brain, as well as insufficiency in men to a very important hydraulic instrument, right? And when that gets better, everything gets better, because it does get better. It makes a big difference. First experiment. Next one, please. Okay. Prime concept in integrated functional medicine. The body's natural state is one of health. Even in sickness, your body will strive to heal itself. My wife, you'll see a picture of her at the end of this, had cancer of the lung, right? Cancer of the lung is the biggest malignancy in the States at the moment. 250,000 new cases a year. When it's diagnosed, in 80% of people, exactly the same as my wife, it's diagnosed stage 3 or 4, it's inoperable. The prognosis may be 3 to 6 months. When my wife died, her lung cancer had disappeared completely from her lungs. Nothing in her lungs. It had moved down into her liver and her abdomen. And that's what killed her. She died of a mixture of renal and hepatic failure. But her body was frantically trying to heal itself. It was just too much, it couldn't do that. She actually lived for 30 months, not for 3 to 6 that she was given. And the kind of death that was predicted for her didn't happen, thank God, right? And I know why. I don't want to pat myself on the back, but part of it was the neighbor saying to her one day, I think your husband needs to go on holiday. Because when she wouldn't do what I wanted her to do, I would scream and I would go crazy, because I was frantic to try and save her. I was frantic. And I learnt a lot, because the day I got the diagnosis, I came home and I sat down on the internet and I spent time on the internet. I got myself another computer. I put it upstairs in the bedroom. I got a light so I could sleep in bed and I could read and learn. And my feeling is that what I've learned, I don't want to disappear. I want to try and, you know, it sounds insane that I should be so altruistic about this, but I would really like to see if I can help a few people with what I learned and not just let it go away. This is why I called it Barbara's legacy. She taught me this. It was a horrible lesson, but this is what I learned. So, treat the body right, correct diet, and sun, and I'll come back to that, not only prevent a host of chronic illnesses, but with slow progression and reverse many. Chronic diseases, a heart disease, high blood pressure, obesity, type 2 diabetes, which can be cured 95% by eating the right thing. Chronic arthritis, many cancers, and I'll show you that. Multiple sclerosis, 95% of patients with MS can be completely cleared up. If you get a diagnosis of MS, 50% of the patients will be dead in 10 years. But you don't need to do that, because there's a man called Roy Swank. He died at 99, an American. He had a series of 5,000 patients with complete cessation of their MS, who then lived for 25 years, who had MRIs of the brain and CAT scans of the brain with no progression of their lesions. Okay, next one please. Autoimmune disease. This is self-explanatory. If your doctor looks like that, you must just get up and run. You shouldn't have a doctor. Next one please. Okay, there are two kinds of diseases. Diseases of poverty, which happen in third world and developing countries, and disease of affluence. First in developing world countries. And we are a developing world, so we're starting to get a lot of that amongst what's called black diamonds. Next one, please. But not only in those. The disease of poverty. This is what happens to rural black people and people in the squatter camps. Pneumonia, diarrheal diseases, measles, malaria, high infant mortality, HIV and tuberculosis, causes 75% premature deaths in South Africa. I was watching a thing on the E! News last night, and the incidence of HIV in KwaZulu-Natal is absolutely horrifying, right? And in this country is an American investigation of the longevity in South Africa at this time, and it's come down from 52 to 47 because of HIV. And now there are kids in orphanages and in homes. Both the parents have died of AIDS. Okay?